States and hospitals across the country are scrambling to find ventilators to handle a surge of critically ill patients, but the lack of machines is just part of the problem. As Scott Friedman tells us, there's also an urgent need for respiratory therapists to run those machines.
They're some of the unsung heroes of the ICU. Respiratory therapists help keep the most critical COVID-19 patients breathing.
We are frontline. I mean, we are oftentimes the person that sticks the tube into the lungs, intubate the patient. So we're frontline with these patients.
Tom Kallstrom is a respiratory therapist and head of the American Association for Respiratory Care, headquartered in Irving. For the first time in his career, he's confronting questions about whether some cities will have the staff for the number of ventilators needed.
I'm hoping that this won't get to that point. I don't know. It's anybody's guess as to how this is going to happen.
Across the country, there are about 155,000 respiratory therapists, about 14,000 in Texas. Kallstrom is trying to create a virtual strike force, surging staff to cities in crisis. He's reaching out to retired therapists, even looking at ways to put students to work.
We just put a survey out to every school in the nation yesterday to find out do they have the capabilities of sending students to the hospitals as well.
Hospitals say they have plans to shuffle ventilators to places that need them most and to find more staff to run them.
Trust me, our human resource leaders at all our hospitals and systems are working 24/7 to look at existing staff, where we're short on staff, and what we can do to beef up that staff.
In ICUs, respiratory therapists often move between patients, caring for more than one at a time. But the current crisis is already testing their limits.
It's exhausting. It's hard work. It's mentally and physically hard, even without a pandemic.
In places like New York, doctors are getting closer to making life and death decisions about who will get a ventilator. In recent days, there's been talk of putting two patients on the same ventilator. Kallstrom's group and groups representing critical care nurses and anesthesiologists oppose that idea, saying it cannot be done safely. People with CPAP machines are wondering if their devices could be used to help with the shortage, but experts say there's no way that would work. Ventilators breathe for you when you can't breathe on your own, while CPAP machines give you a gentle, continuous flow of air while you sleep. A sleep medicine doctor at Baylor says the machines can also potentially spread a virus like COVID-19.
CPAP device has a persistent air leak, which could possibly include some of these aerosols, these little small bits of mucus. And in the same way, the spread of those aerosols to nearby individuals is possible.
If you suspect you have coronavirus, doctors say you should not sleep next to anyone and talk to your doctor right away about whether or not you should keep using your CPAP machine.